If you or a loved one has been diagnosed with cancer, you may have come across the chemotherapy drug called oxaliplatin. But what exactly is oxaliplatin used for, and how does it work? In this comprehensive guide, we will explore the main uses of oxaliplatin, the recommended dosage, potential side effects, and even hear from real users who have shared their testimonials. Oxaliplatin is primarily used in the treatment of colorectal cancer and is often used in combination with other chemotherapy drugs. Its unique mechanism of action works by inhibiting the growth of cancer cells and preventing them from spreading further. By understanding the main uses of oxaliplatin, you can have a better understanding of how it may be beneficial for you or your loved one's cancer treatment. However, like any medication, oxaliplatin does come with potential side effects. It is important to be aware of these side effects and discuss them with your healthcare provider. Additionally, hearing from others who have undergone oxaliplatin treatment can provide valuable insights and help you make informed decisions about your own treatment plan. So, join us as we delve into the world of oxaliplatin, exploring its main uses, recommended dosage, potential side effects, and real user testimonials. Main uses of oxaliplatin in cancer treatment. Oxaliplatin is primarily used in the treatment of colorectal cancer, specifically in the adjuvant and metastatic settings. In the adjuvant setting, oxaliplatin is used after surgical removal of the tumor to prevent its recurrence. It is often combined with other chemotherapy drugs, such as fluorouracil and leucovorin, to enhance its efficacy. In metastatic colorectal cancer, oxaliplatin is used as a first-line treatment in combination with other chemotherapy drugs, such as fluorouracil, leucovorin, and irinotecan. This combination, commonly known as FOLFOX or FOLFOXIRI, has shown promising results in prolonging overall survival and improving response rates in patients with advanced colorectal cancer. Aside from colorectal cancer, oxaliplatin may also be used in the treatment of other types of cancer, such as pancreatic cancer, gastric cancer, and ovarian cancer. However, its effectiveness in these cancers may vary, and it is best to consult with your healthcare provider to determine if oxaliplatin is an appropriate treatment option for your specific cancer type. Recommended dosage and administration of oxaliplatin. The recommended dosage of oxaliplatin may vary depending on the specific cancer being treated and the treatment regimen being followed. Generally, oxaliplatin is administered intravenously in a hospital or clinic setting. In the adjuvant setting for colorectal cancer, the standard oxaliplatin dosage is 85 mg per square meter, administered every 2 weeks for a total of 12 cycles. This is typically combined with fluorouracil and leucovorin. In the metastatic setting, the dosage and administration of oxaliplatin may vary depending on the specific treatment regimen being used. For example, in the FOLFOX regimen, oxaliplatin is typically administered at a dosage of 85 mg per square meter, combined with fluorouracil and leucovorin, and given every 2 weeks. The treatment duration may vary depending on the response to therapy and individual patient factors. It is important to note that the dosage and administration of oxaliplatin should be determined by a healthcare professional, as they will consider various factors such as the patient's overall health, kidney function, and any pre-existing conditions that may affect the use of oxaliplatin. Potential side effects of oxaliplatin and how to manage them. Like any chemotherapy drug, oxaliplatin can cause a range of side effects. It is important to be aware of these potential side effects and discuss them with your healthcare provider before starting treatment. Some common side effects of oxaliplatin include peripheral neuropathy. Oxaliplatin can cause damage to the nerves, resulting in symptoms such as numbness, tingling, and pain in the hands and feet. This side effect is often cumulative and may improve after treatment completion. Medications such as gabapentin or pregabalin may be prescribed to manage neuropathy symptoms. Fatigue. Many patients undergoing oxaliplatin treatment may experience fatigue or a general feeling of tiredness. It is important to listen to your body and rest when needed. Engaging in light physical activity, such as walking, can also help combat fatigue. Nausea and vomiting. Oxaliplatin can cause gastrointestinal side effects, including nausea and vomiting. Antiemetic medications may be prescribed to manage these symptoms. It is also important to follow dietary recommendations provided by your healthcare provider to help reduce nausea. Some patients may experience diarrhea as a side effect of oxaliplatin treatment. It is important to stay hydrated and follow a diet that is gentle on the digestive system. Your healthcare provider may also prescribe medications to manage diarrhea. Hematological effects. Oxaliplatin can affect the blood cells, leading to a decrease in white blood cell count, red blood cell count, and platelet count. This can increase the risk of infections, anemia, and bleeding. Regular blood tests will be conducted to monitor these parameters, and your healthcare provider may recommend interventions to manage these effects. It is important to communicate any side effects you experience with your healthcare provider, as they can provide guidance on managing them and may adjust your treatment plan if necessary. User testimonials and experiences with oxaliplatin. Real user testimonials and experiences can provide valuable insights into the effectiveness and side effects of oxaliplatin. Here are a few testimonials from individuals who have undergone oxaliplatin treatment. Sarah, a colorectal cancer survivor, shared, "Oxaliplatin was a crucial part of my treatment plan. While the side effects were challenging, the combination of oxaliplatin, fluorouracil, and leucovorin helped shrink my tumor and improve my chances of long-term survival. It was a tough journey, but I am grateful for the effectiveness of this treatment." John, who underwent oxaliplatin treatment for metastatic colorectal cancer, said, "The peripheral neuropathy was the most difficult side effect for me. It affected my ability to perform daily tasks, but with the support of my healthcare team, I managed it with medication and physical therapy. Despite the challenges, oxaliplatin helped control the progression of my cancer, and I am now in remission." Lisa, a pancreatic cancer patient, shared, "Oxaliplatin was a part of my treatment regimen, but unfortunately, it did not have the desired effect on my cancer. Everyone's journey is different, and it is important to work closely with your healthcare provider to determine the best treatment options for your specific cancer type." These testimonials highlight the individual experiences and outcomes of oxaliplatin treatment. It is important to remember that everyone's response to treatment may vary, and consulting with a healthcare professional is crucial for personalized treatment decisions. Precautions and contraindications when using oxaliplatin. While oxaliplatin can be an effective treatment option for certain cancers, it is important to consider precautions and contraindications before starting treatment. Some factors to consider include allergies. If you have a known allergy to oxaliplatin or any other platinum-based chemotherapy drugs, it is important to inform your healthcare provider. Allergic reactions can be severe and may require immediate medical attention. Kidney function. Oxaliplatin is primarily excreted by the kidneys, so it is important to assess kidney function before starting treatment. Your healthcare provider may order blood tests to evaluate kidney function and adjust the dosage of oxaliplatin accordingly. Pregnancy and breastfeeding. Oxaliplatin can be harmful to a developing fetus, so it is important to discuss pregnancy plans with your healthcare provider. Similarly, it is not recommended to breastfeed while undergoing oxaliplatin treatment, as the drug may pass into breast milk. Other medications and conditions. It is important to inform your healthcare provider about any other medications you are taking, as well as any pre-existing medical conditions. Some medications or conditions may interact with oxaliplatin or increase the risk of side effects. Always consult with a healthcare professional before starting any new treatment to ensure its safety and suitability for your individual circumstances. Alternative treatment options to oxaliplatin. While oxaliplatin is a commonly used chemotherapy drug, there are alternative treatment options available for certain types of cancer. These alternatives may include different chemotherapy drugs, targeted therapies, immunotherapies, or even surgical interventions. The choice of treatment will depend on various factors, such as the specific cancer type, stage, and individual patient characteristics. It is important to have open and honest discussions with your healthcare provider to explore all available treatment options and make informed decisions. Your healthcare team will consider factors such as the effectiveness, potential side effects, and your overall health when recommending alternative treatments. Research and studies on the effectiveness of oxaliplatin. Numerous research studies have been conducted to evaluate the effectiveness of oxaliplatin in various types of cancer. These studies have shown promising results in terms of improving survival rates, reducing tumor size, and preventing cancer recurrence. For example, a study published in the New England Journal of Medicine demonstrated that the addition of oxaliplatin to fluorouracil and leucovorin significantly improved overall survival and reduced the risk of recurrence in patients with stage 3 colon cancer. Similar studies have shown the effectiveness of oxaliplatin-based regimens in metastatic colorectal cancer. Ongoing research continues to explore the use of oxaliplatin in combination with other treatment modalities, such as targeted therapies and immunotherapies, to further enhance its effectiveness and reduce side effects. Frequently asked questions about oxaliplatin. How long does oxaliplatin treatment typically last? The duration of oxaliplatin treatment can vary depending on the specific cancer being treated and the treatment regimen being followed. Adjuvant treatment for colorectal cancer usually lasts for 12 cycles, given every 2 weeks. In the metastatic setting, the duration of treatment will depend on the response to therapy and individual patient factors. Can oxaliplatin cure cancer? While oxaliplatin can be an effective treatment option for certain types of cancer, it is important to note that it may not cure cancer on its own. It is often used in combination with other chemotherapy drugs or treatment modalities to achieve the best possible outcomes. Are there long-term side effects of oxaliplatin? Some patients may experience long-term side effects of oxaliplatin, such as persistent peripheral neuropathy. These side effects can vary among individuals, and it is important to discuss any concerns with your healthcare provider. Can I work or drive during oxaliplatin treatment? The side effects of oxaliplatin, such as peripheral neuropathy and fatigue, can impact daily activities. It is important to listen to your body and prioritize your well-being. If you experience significant side effects that affect your ability to work or drive safely, it is advisable to discuss this with your healthcare provider. Conclusion: the role of oxaliplatin in cancer treatment and patient experiences. Oxaliplatin plays a critical role in the treatment of colorectal cancer, both in the adjuvant and metastatic settings. It has shown promising results in improving survival rates and reducing tumor size when used in combination with other chemotherapy drugs. However, like any medication, oxaliplatin does come with potential side effects that need to be managed and monitored. Real user testimonials provide valuable insights into the experiences of individuals who have undergone oxaliplatin treatment. These testimonials highlight both the effectiveness of oxaliplatin and the challenges patients may face with side effects, such as peripheral neuropathy. It is important to have open and honest discussions with your healthcare provider to determine if oxaliplatin is an appropriate treatment option for your specific cancer type. They can provide personalized recommendations based on your individual circumstances and help you navigate the potential side effects of oxaliplatin. Remember, every cancer journey is unique, and by staying informed and working closely with your healthcare team, you can make empowered decisions about your treatment plan.